you need to be under the profession or under the field of pharmacy. Then only you can do with the pharmacy field or pharmacy masters. This is the basic knowledge. Okay, nothing to drag here. So eligibility criteria requirements means your degree certificates and so and all. So likewise, and cost involved and economy. This is very important point, and this is a noted point. Okay, see, in Indian government, all of the states are providing loans and also sponsorship for the MS or MD programs. So you can pay or you can use it as your sponsorship member. Okay, so you need to go for further economically. You need to think like whether you are going for US, it is highly expensive. If you are going for Canada, it is compared to US, it is less expensive. And if you compare to Canada, UK is still more less expensive, and Australia is also overall like a India. So nothing like a expensive it will be. So we'll compare in further slides. Okay, like that it will be. So scope and growth of right after all these criteria has been fulfilled, the fifth point is very important for your life lesson. Okay, so you have read, okay, you have studied, you have got the course materials, you have got the transcripts, degree certificate, everything has been succeeded. But now the first thing coming into your mind means where I need to work and what is the role I can achieve and where will be I hired, in which country I can be hired. Okay, this is the question mark in every student. Okay, while you are pursuing and right after the pursuing up to 1 or 2 years, or it may be in some people will achieve within a month and some people will take time. Okay, career is not built in a overnight. This So scope or growth of a career prospects. But according to my experience, don't worry guys, pharmacy is not a small profession. I mean, small. It is a big. It is a like it is like a ocean. Okay, so daily one disease will be there. Okay, daily one innovative diseases we are coming up with like viral, bacterial. So likewise, we are the PharmDs or master of PharmDs. Okay, masters like we need to innovatively think like what medicine it should be done and what research we can conduct for further overcoming this all of the diseases. So it is not a ruined profession. Okay, it is a growing profession. Day by day, it is upgrading. Previously only D pharma we used to hear, and now later D pharma it has become B pharma. Okay, bachelor it is a skilled professional. Okay, then masters. Okay, then now we are competing to the MBBS doctors like PharmDs. Okay, so likewise, this is all the things what we have coming up with the pharmacy profession, and still also it is growing. I'll challenge that every student will recognize as a doctor. It is not like a MBBS graduate. I'm not comparing and I am not comparing anything to the medical profession. We are the professions. We are the backbone of the medical profession. Okay, without our pharmacy, there is nothing we can expect the medical profession. Okay, so that's all I can say. So first, we'll target, as I told, first challenge best countries for the masters in pharmacy. What are all the best countries? Select the country. Okay, which country you need to go or which country you are willing to go. Okay. See, first of all, there are topmost countries apart from India. Okay, United States of America, United Kingdom, Canada, Australia, United Arab Emirates, nothing but UAE, Germany, Netherlands, and New Zealand. Okay, these are the top countries which are giving the masters in pharmacy and also PG programs to appeal. Okay, so you can go with whatever you wish. Now, second challenge, registration procedure. See here, I told registration procedure you can't directly go. You if you go, it is their option. But if you go directly to the website, it will be very time taking process. Okay, if it is completed in 3 months, it will take like a 6 months, 9 months, 1 year. So likewise, right after completing your Form D, so it will take like so much of the time, or it will ruin your mental condition. Why it is taking so much of time? Likewise, okay. So no need to waste the time. So let's get into what are all the websites, consultancy websites that are giving the opportunity. First one, I approached idp.com. It is available overall India. Okay, you can Google it in, or you can go with the Chat GPT also. AI tools are there. So leverage education and idp.com. As I told, I approached idp.com. Okay, so inspires education, upgrade abroad, RR overseas studies, Suleka abroad consultants. Okay, so these are the top consultancies that are dealing for the masters in pharmacy. You can select plenty of the courses, not only the pharmacology, not only the pharmaceutical sciences or anything, etc. You can approach this consultancies. You will get to know what to do further. They'll guide you like a stepwise manner without confusion, guys. They'll right after you are searching in Google, they'll take your number. Okay, directly they'll take. It is if you type it in their website, you'll have the call within a fraction of seconds to minutes or within a days. Likewise, they are very cooperative. Okay, without the confusion, they'll guide you. Okay, so likewise, and now this is the first. In second challenge, this is the first point: difficulty in finding consultancy. Nothing difficulty, as I mentioned. These are the top one. Okay, so difficulty in finding university. So right after selecting the consultancy, you are confusion. Okay. So which country, or right after selecting the country also, they'll ask which country you need to go. They'll ask. You are clarifying like Canada, US, etc., etc. So right after that, which are all the universities you need to get into the particular course. Which course you have selected and which university you need to select. That will be given in the PDF format by the consultancy people. Okay, they'll give one format like these are the university list and these are the countries and these are the places to pursue your further PG. Okay, so likewise, as I know, I'm aware of Canada. Okay, in even US also, my colleagues and so many people have been shared their experience. Even I know the US, but I can't mention here because I have truly into the Canada, so that one only I can give you. Okay, with exact guidance. So, university in Canada, there are I have mentioned only top 5 universities. Why top 5 universities? Because you will get definitely a job role. Okay, another universities is also there depending on your skills. It is higher. Okay, nothing like that. I'm not saying like apart from this no one will get job, nothing like that. It is based upon your knowledge and how you will improve day by day right after getting into the PG. Okay, so top 5 universities in Canada: University of Toronto, McGill University, University of British Columbia, Vancouver. This is what I have studied, UBC. Okay, so now University of Ottawa and University of Alberta. Okay, these are the top 5 universities that are giving the PG program or master's program in pharmacy profession. Okay, so now third point: difficulty in PEBC exam. As you know, if you want to if you want to pursue your masters in Canada, you need to know that the exams will be conducted in stage one. That is called PEBC, nothing but Pharmacy Examination Board of Canada. Like how we are passing your exams, no, in India and all. So likewise, only there are. This is only for overseas students, not for their home country students. Okay, home country students will be only having the PEBC one, that is credential evaluation exam. Is nothing but your certificates will be evaluating whether see here PEBC. Keep apart from the home country students, we are only discussing to the overseas students. So now PEBC one, credential evaluation exam. PEBC stands for, you know that one, Pharmacy Examination Board of Canada, means that stands for your credential should be equal to the home country of the Canada students. Means like mandatory you need to have the same subjects which is compared to the Canadian students. Okay, it will be almost the same, nothing to be right after PharmD I'm saying. Okay, so you need to be have that all the basic criteria like anatomy, physiology, pathology, then biochemistry, medicinal chemistry, so and so, pharmacology, toxicology, everything like clinical research, everything will be evaluated with your transcripts. Okay, subject knowledge and basic information of your course. Okay, subject knowledge means like evaluating the credentials means you need to be ready with the transcripts, and also you need to pass. Okay, you need to pass means they'll take a there is one GPA score will be there. Like here we are getting like 65 to 85 percentage is mandatory. Okay, this is the minimum and maximum mandatory percentage of our country. Okay, likewise in Canada, they won't consider it as a percentage wise, they'll consider it as a GPA score. Okay, GPA is nothing but it is a score that is required for the eligibility to enter into the PG. Okay, so I'll tell what is the minimum and maximum GPA score. Like a 2.7 to 3.5 GPA score should be maintained. Like nothing but it is a 68 percentage to 79 percentage according to India. Okay, this is the GPA score. And now, if you attain this GPA score and you have the particular transcripts in your hand, and you have the home country license, if you submit to the consultancy which you have selected to the particular country and particular university, they'll submit to particular website. Okay, then you will get one examination hall ticket that is called PEBC2. Means what are all the subjects you have learned in the PharmD, like biochemistry, pathology, physiology, biopharmaceutics and toxicology, pharmacology. What are all the basic subjects what you need to attain that are all will be merged and given in one booklet, and they'll take online test or online exam. Okay, you can write overall in India. Okay, anywhere sitting in any of the place you can write in India. It is not like mandatory. You need to travel to Canada, then only I can write. Nothing like that. It is a computer-based exam. Okay, so now and basic information of study course. You need to have why are you into the pharmacy profession and what is your basics. Like what is your basics? If you have into the pharmacy means you need to be well fit for the biology and chemistry based. Like if you take in the 10 plus 2 means you need to be perfectly with the zoology subject and also organic chemistry subjects. Okay, organic and inorganic both. Overall chemistry and zoology subject should be known very well. This is the basic information of the course study. Then only you can pursue further. And now, fourth point, difficulty in finding master's course. Okay. So as I told, when you are going into the consultancy, you are very confused. Okay. So which course I need to select? What is the scope? Likewise, they'll tell. Don't worry, they'll tell. Like me only, they'll tell which course is now booming and what you need to take, and further what is the role to be hired. Okay. So masters in science in pharmacy. Science is nothing but it is dealing with the pharmaceutics and mainly organic chemistry. Okay, completely pharmacy preparations and storability. Okay, Masters of Science in Pharmaceutical Sciences. Pharmaceutical means it is a completely industrial based subjects will be there, and Masters in Pharmacology. What I have done. Okay, so Masters in Embryology. Why embryology they have taken? See now, you can see in our daily lives, particularly when they have married at young age, they may like it is not based upon the age. It is based upon their hormonal fluctuations. Miscarriages are more commonly we can see. But if you study the embryology means to particular supplements and to particular medicine, you can be involved to grow that embryo for the specific and for the dealing with the non miscarriages and taking further the development of the particular fetus. Okay, so likewise, it is completely based upon medicinal treatment for the embryo growth. Understood? Okay, no surgery, nothing and all will be there. You are treating with the medicines means like supplementals or multi minerals which you have involved with your preparations or with your well known knowledge, you can treat that embryo. That is called the master's in embryology. Master's in clinical research. You know this nothing to be dragged here. Clinical research means innovatively you need to think for the particular drug or particular disease. Okay, like how corona vaccine has been invented within 1.5 to 2 years. Likewise, only clinical research will deal with the particular medicine based disease. Okay. And now MBA in pharmaceutical, cannabis applied sciences. Cannabis applied sciences means it is the applied science dealing with the venues or like a particular insects bite. Likewise, it is a cannabis. Okay, so apply. You are applying day by day. You are applying to what to how to give and what to give to the particular dose and antidotes. Okay, this is the applied science. Okay, MBA in pharmaceutical sciences. This is an administrative course. How the marketing will be done, how the sales will be done, and how the manufacturing will be done. So likewise, okay, based upon the manufacturing, how you need to keep the stocks. Same like a MBA business people will be doing their routine things. No, likewise only here we are doing with the pharmaceutical sciences. Okay, and finally, masters in pathophysiology and pharmacology. It is the same like a masters in pharmacology. Like you are dealing with the anatomy and physiology, and that basic knowledge you are applying to the medicines, how to give and what to give and which organ has been damaged and how you need to recover from that. Okay, that is the main criteria of this subject. And now third challenge, okay, eligibility criteria and requirements. As I mentioned, third challenge, what you need to do. I told initially, like minimum of 5 years should be mandatorily. You need to pursue your academic course. Okay, academic completion should be done by handing your transcripts. Okay, minimum of 5 years. The maximum it is up to you, like internship or rural areas fellowships or apprenticeships. It is based upon your choice, but minimum of 5 years course, academic course should be completed. Okay, and education credentials, as I told, 10th standard, 12th standard, and degree transcripts and certificates should be um, submitted, and, and later you can submit the home country license. Okay, so now all of the above points should be also followed with your English proficiency test. You need to write because we are not traveling to our state to state. You are not traveling to the state to state. You are traveling to the overseas countries means then see, apart from India, almost all of the countries will be only mandatorily speaking the English. Okay, so apart from some of the European countries, they'll speak like Spain, Germany, depending on their languages. But when you are traveling to the Western countries, they'll most probably they'll be speaking in English. So hence, your speaking skills will be tested and it is given in the mark sheet. Okay, the TOEFL and IELTS, I think. Okay, so this is the English test to mandatorily you need to take that one. There is no other option. It is mandatory. Okay, by following this test and you need to follow this criteria, education credentials, and keep ready with your passport. This is basic thing. Okay, so right after this, fourth challenge, cost involved and economy. So most of the people will be waiting for this slide, I think, right? Huh? Okay. So around, if we discuss, this is on an average I have taken. It may be less, it may be more compared to your university. Okay. Yeah, it will be, but this is the on an average cost I have taken. If you approach to particular consultancy, they'll be giving all the informations. Okay. So in Canada, it will be around 38 to 70 lakhs. Okay, according to Indian rupee, I am mentioning. Okay, if I give it in dollars, means you will not get. Okay, so likewise, I have mentioned here. United States of America, 45 lakhs to 80 lakhs. It is like little bit. It is expensive, guys. Think once and relocate to that. Okay, United Kingdom, 25 lakhs to 55 lakhs, and Australia, 30 lakhs to 45 lakhs. Spain, 11,950 USD, means US dollars, and Germany 30 lakhs to 50 lakhs according to Indian rupees. Okay, so this is all about the cost, and this is the last challenge. Okay, so fifth challenge, that is the scope and growth in career. How you will grow and what is the scope. Okay, you can work as a clinical pharmacist even if you pursue a PharmD, you are paid as a clinical pharmacist, but compared to PG and normal PharmD, there is a fluctuating in your salary. See, if you are normal PharmDian and you will be paid around 30 to around 20 to $30. If you are PG, means right after PharmD you have done your PG, means you will be paid like 50 to $80 per hour. I'm saying. Okay, this is just an example I'm giving. Okay, pharmacologist, hospital pharmacist, the roles will be not changing, but the payment or salary and hikes will be changed according to your course and according to your skills. Okay, so likewise, uh, yeah, hospital pharmacist, pharmaceutical industrial administrator, healthcare administrator, public health services, and community health services. Okay, these are all the roles you can be hired in hospitals as well as in industries. And finally, how the salary and growth will be. According to United States of America, in India, we are paying like per day or per month or per year or per annum it is. Okay. So per day like 1,000, 2,000 they'll pay. But in US or not even US, in the Western countries, they'll pay like hours based. Okay. So it is far better than India, right? One who is working in the Western countries, they'll get settled soon because of this advantage, because they are not paid in a monthly wise or a day wise. They'll be paying in a hours based. Okay. See here, United States of America, 18 to 35 US dollars, okay, per hour it is. Calculate, okay. See with the currency rate of today or when you are going the job, check it with and multiply it into our Indian rupees. You will get to know the what is the rate of our per day per hour payment. Okay. So United Kingdom 12 to 28 UKD, United Kingdom dollar, okay, per hour it is also. And Canada 15 to 30 CAD. CAD is nothing but Canadian dollar. And Australia 20 to 30 AUD. Okay. So nothing but Australian dollar. Germany 45 euros per hour. Okay. And UAE, United Arab Emirates, they are paying 90 dirhams per hour. Okay. This is all the salaries and growth. Okay. Don't worry, this will be fluctuating based upon your skills. Again and again, I'm saying this will be fluctuating based upon your skills and resume and what you have done your course study. Okay, so this is very important, guys, because don't ruin your college days when you are learning. Day by day, you need to improve. Okay, then only see, no one will ask right after finishing your degree. What is the percentage? What is your marks? No one will ask what you have learned and how you will pay. Okay, what is the salary and how you are innovatively thinking and what is the position of yours. Okay, like that they'll ask. Position is based upon your mind. Okay, okay, what you are applying in your profession, that is very important. Okay, based upon that only they'll be paying. So now, finally, thank you for your patience. And if any queries, please put a message in chat box, guys. Yes, yes. Uh, Please put a messages. Yes. Hope that everyone has been understood with basic things, how you need to study masters or PG programs overseas countries. So yeah, if any queries, please let me know.
Thank you, ma'am, for that enlightening session. Your expertise is truly invaluable, and we are grateful for your insights in Second Season 5. Thank you, ma'am.
Okay. Thank you, guys. Hope that